just like to welcome everyone, and thanks very much for coming along. I have a little bit of housekeeping to go before we start the introductions. So I just want to make everyone attending aware that there might be young people under the age of 18 here at this webinar, and therefore child safeguarding arrangements will apply. If you're going to tweet about the event, could you use the hashtag LGBTI landscape, all one word. Um, the ground rules, particularly because of more young people being present, will include mutual respect. Anyone using insulting or derogatory language will be removed from the webinar. The presentations will all be recorded, and so we're asking everyone to keep their microphones muted, and you can turn off your camera if you don't want to be seen. There'll be a link to the NUI Galway Child Protection Policy, and that'll be pasted in the chat box. If you do want to participate, leave your microphone off, but just raise your hand and we'll get to you. We're asking everyone not to send private messages through the chat function to other participants. If anyone does receive an inappropriate private message, then they can contact me or Saoirse McGowan and we'll follow up on it. If you're concerned about any other child safeguarding issue, please again contact either me or Saoirse McGowan from NUIG, and again we will follow up on it. Please don't take any screenshots of this meeting, and there will be some support information at the end of the webinar. Thanks very much, and I'll hand you over to Bernie.
Thank you, Eileen, and good afternoon, everybody. You are really welcome to this launch this afternoon. My name is Bernie McNally, and I'm Assistant Secretary General in the Department of Children, Equality, Disability, Integration and Youth. As I said, you're really welcome to the launch of this great report entitled LGBTI Youth in Ireland and across Europe, a two-phased landscape and research gap analysis. It is fabulous to see that the numbers that have registered for today, and it's equally fabulous to see the breadth of where you have all come from, the number of organisations, etc., that are represented here today, as well as individuals in their own right. We know that listening to LGBTI young people is such an important role, and we're so delighted that so many organisations who take that responsibility so seriously are here today. This critical report became very evident back in 2018 when the department published the first of its kind almost in the world, a dedicated LGBTI plus youth strategy. The need for evidence to inform policy was very apparent, and the report today is just such a great result coming from that. So the report today shows that in Ireland and across Europe, the research landscape, it is uneven, it is highly varied, and there are significant knowledge gaps. And it's really important that we have this report now so that we can start to address those gaps. And the report tells us today that we need to address those gaps with robust methodology, and really importantly, that we do so via engaging with LGBT plus young people. So we really appreciate you being here. We really appreciate the authors of the research and the amount of work that they've put in, going above and beyond the call of duty as such to do this really important piece of research. The youth strategy that I mentioned that we published back in 2018, it was, I believe it was a very important milestone for LGBTI plus youth in Ireland. It had 3 goals and 15 objectives, and they all linked in very nicely with the overall framework, Bob F, Better Outcomes, Brighter Futures, and the 5 outcomes that we want for all young people in Ireland. But goal 3 of that strategy was really important, because goal 3 set out that we needed to really build up the amount of research that was done. We needed more research on LGBTI+, and very importantly, that we needed high quality research, that it wasn't just good enough, as we all appreciate, to have research, that it needed to be high quality research. And also that we needed to specifically target some areas. So there were some particular areas of policy priority that we needed to target for research. So in line with the LGBTI youth strategy, we commissioned the Health Promotion Research Centre in NUIG to investigate the research that already exists on LGBTI plus youth lives and well-being in Ireland and in Europe, and to tie those findings back to the objectives of the LGBTI National Youth Strategy. I have to say a huge congratulations again to the Health Promotion Research Centre on what they have done. They've really produced an excellent exploration of research across a really broad spectrum. And when I was reading in preparation for this event, it really struck me how wide that spectrum is. So they looked at research involving education, safety, youth services, work in inclusive environments, representation and participation, supports to caregivers, capacity building for service providers, gaps in legislation and policy, fragmentation in funding and networking for collaborative work, mental and sexual health, and transgender and intersex youth and research. So as I said, a huge spectrum, and they've managed to do really good justice to it. I think everybody that's here today understands the importance and the necessity of ensuring all children and young people are actively encouraged and included in our society. And with the wealth of research developed in this area, we can work towards ensuring that this is the case for all of our young people, that it isn't just an ambition anymore, that all our young people are included in society and valued in society. This research really helps us pave the way for safer, more inclusive and supportive spaces, better decision making, better design of services, better policies, better programs for LGBTI plus young people. So we have a number of speakers that are going to speak to you today. The next speaker is going to be the Minister, and I will introduce the Minister in a moment. But just to give you a feel for the rest of the session, after the Minister, we're going to speak to the lead researcher on this fabulous piece of work, Dr. Andras Kolto. So he'll represent the other great authors of the report. We're then, very importantly, going to hear from two young people, and they're very central to today's event. So Clodagh Scott and Cameron Kieran are really, really welcome, fantastic young people who are going to offer us their insights and takeaways from the report. We're then going to have an opportunity for some questions. So please do use the chat bar. You'll see that the chat bar is open. Please do use it. If we don't get a chance to respond to all the questions, please be assured that they're really helping. That feedback is really, really useful and will really help inform the researchers and the policymakers and the service providers, etc., on this call. And we're also going to ask you all to join us for just 15 minutes of a breakout room later on. So again, those breakout rooms are going to be really important for us to get some feedback from you. I have to say, as a policymaker, that often those breakout rooms, they've become the most important element of many of these interactive sessions in these COVID times. So we'd really appreciate if you could stick with us for that. And you're not going to get a job, because we will have a note taker and a facilitator from both the team in Galway and the department to help out in those sessions. So without further ado, I am going to introduce you to, I think what I can say in a very evidence-based manner is that the next speaker is an absolute champion of equality generally, but very particularly for LGBTI and LGBTI young people, for the rights of people. And he's also a massive champion of evidence-based policy, good policy that is evidence-based. So to the Minister for Children, Equality, Disability and Integration and Youth, Roderick O'Gorman, you're most welcome. Over to you.
Thanks a million, Bernie. Really appreciate that kind introduction. And I want to say good afternoon to everyone. It's a huge pleasure to be here for the launch of this report. As Bernie was saying, it's great to see so many people on the call. I think about 130 people joining us for this launch at this point, and it's great to see we've been able to facilitate so many people who are interested in the launch today. First of all, I'd like to just offer my thanks to NUI Galway for their work in organising and facilitating the webinar, but also for their continued support to the Health Promotion Research Centre. And I'm aware that on the call today we've young people, we've government officials, NGOs, educators, researchers, policymakers, and we have a wide range of representatives across many different sectors attending. And I think no matter what people's background is, no matter what organisation they represent, I think all of us here on this call, we share a common goal towards the health and happiness of every child and every young person in our country. And I think despite the many and very significant positive societal changes that have occurred over the past 30 years, young people who identify as LGBTI plus or other sexual and gender minorities, they do experience worse health and life outcomes than those who identify as heterosexual and those whose sex was assigned at birth and gender identity were aligned to each other. And as the report notes, many of these outcomes can be traced back to adolescence, but have effects which will actually last long into adulthood, with two central concepts, that of stigma and that of minority stress. And this is why it is absolutely so important that we have an LGBTI plus national youth strategy. And this strategy, which was first published in 2018, and as Bernie mentioned, was at that time the world's first governmental strategy to improve the lives of LGBTI plus young people. And it's an action-oriented strategy, and it recognizes that LGBTI plus young people can flourish when they have consistent positive interactions with those who are around them. And I'm conscious that many of the people under the remit of this department were traditionally excluded or were silenced by the policymaking process. So in going about our work, we are firstly always keen to hear directly from those impacted by the policies that we implement. And secondly, that these policies are always informed by the best available evidence. And importantly, the National LGBTI plus Youth Strategy was created in consultation with the people affected by the issues that it seeks to tackle. The LGBTI plus National Youth Strategy remains a key commitment for my department as part of the current programme for government. It is also central to achieving the government's broader commitment to strive for the full inclusion of LGBTI plus people in Irish society. As Bernie mentioned, Goal 3 of the strategy states the importance of identifying what research has been carried out already, but also what research needs to be carried out in order to better understand the lives and the needs of LGBTI plus young people. And it also states that the quality of LGBTI plus data needs to be improved, and more targeted use of data can really inform policy and service delivery. And the Health Promotion Research Centre in NUI Galway was commissioned to investigate exactly what research exists on the lives and well-being of LGBTI plus young youth in Ireland and in Europe, and to map the findings against the objectives of the LGBTI plus National Youth Strategy. And the aim was to document what objectives were well supported with scientific evidence, where there were information gaps, and particularly where more research is needed. And after reading this analysis, it's clear to see that there is a large amount of evidence to support our objectives in the LGBTI plus National Youth Strategy, including evidence on creating supportive environments for LGBTI plus young people in schools and colleges, and on the experience of LGBTI plus young people of bullying. But it's also clear from the evidence that if we want to create these safer, supportive environments for LGBTI plus young people, we have to engage with them in an inclusive process, developing that environment and ensuring that they feel valued and that they feel included. But there are also research gaps with regard to other important issues. And there are a number of these particularly identified by this research. First of all, we don't know enough about the lives of transgender and intersex young people, and about the views of parents and families of LGBTI plus young people and how to support them better, or about developing inclusive work environments for LGBTI plus young people. These are all issues of the highest importance, and we must find a way to address these research gaps. Future research needs to involve LGBTI plus young people, their families, and the many other sources of supports like teachers and youth workers. Rather than only focusing on what is going wrong for LGBTI plus young people, we need more evidence on what is going well and how to improve their well-being and resilience in order to make things better for them. I want to take this opportunity to really give a sincere thanks to all of you who contributed to the publication of this analysis. It has been very useful to see highlighted which aspects of LGBTI plus youth and youth health and well-being need to be prioritized for greater attention. And I'd particularly like to thank the research team in the Health Promotion Research Centre in NUI Galway for their stellar work in this analysis. They continue to produce high quality research of national and international significance that supports the development of best practice and policy in the promotion of health. So let me thank Dr. Andras Colto, Dr. Elena Vaughan, Dr. Colette Kelly, and Professor Saoirse Nic Owen for their dedication to this document. And let me pay tribute also to the officials in my own department for their tireless work behind the scenes on this project. So I would ask all of you here today, please take the time to read and share this analysis so we can all work together in ensuring that our LGBTI plus young people are accepted, encouraged, and included, while continuing to have an equal voice in Irish society. Thank you all very much for attending this afternoon.
Thank you, Minister. We really appreciate your time. There's so many demands on your time. We really, really appreciate you being with us live here for this very important event this morning. And I really like the way that you emphasized something very important about the study, that, you know, there were two areas to focus on. One was investigating risk factors, which is kind of almost a negative, and the other was about looking at sources of resilience and well-being, because we know that there are so many young people that have managed very successfully to look after their well-being despite all the challenges. So research on both risk factors and sources of resilience and well-being has been a really, really important aspect of this study. So thank you again, Minister. And we'll now move on to introducing, as I said, the key author, Dr. Andras Colto, presenting on behalf of his colleagues. So Dr. Colto is a senior postdoctoral researcher in the National University of Galway, specialising in health promotion and particularly children and adolescent health. A wonderful CV, which you can read about yourselves in due course, both in Ireland and in Hungary. But I imagine one of the things he's very proud of is that he chairs the World Health Organization group on sexual health behaviours in school age children. So it's just one of the various pieces of research that he's leading out on, and he has a number of publications in the area in recent years. So over to you.
Many thanks, Assistant General Secretary McNally, for your kind words and for introducing me. And many thanks, Minister O'Gorman, for his speech, in which actually he earned many of my breath. So I can really shorten my presentation, as he really highlighted some of our important findings. And before I introduce the key findings of the study, I would like to mention that this is the World Pansexual Visibility Day. And I think this is a good occasion to remind ourselves that beyond or beside lesbian, gay, bisexual, transgender and intersex, there is a plus sign. So actually the LGBTI plus abbreviation covers a lot of sexual and gender minority people who are not in these groups. It's a lot wider and much wider group than only LGBTI, and we should celebrate all of them today and recognize that variation. The second thing I would like to mention, that we have 131 participants at the moment. We had 240 registered, but we are quite glad that more than the half of you managed to join us this afternoon. And besides people from Irish organizations and colleagues from various Irish institutes, there had been a number of international registrations from North Macedonia, Canada, Spain, Hungary, Ukraine, the United States, Australia, France, Austria, Belgium, Scotland, England, and Northern Ireland. So we are really very happy that the report gained international traction, and we hope that our work can be used not only in Ireland, but in other countries as well. On behalf of my co-authors, I warmly welcome you. And now let's move on why we have done this research. And the LGBTI plus national youth strategy has 3 separate goals and 15 objectives. And the third goal was to develop the research and data environment to better understand the lives of LGBTI young people. And under this goal, there is a standalone objective, the 15th one, to enhance the quality of LGBTI plus data and commission further research to make it sure that further policy actions and service delivery is based on the best available evidence. That's why the Department of Children, Equality, Disability, Integration and Youth commissioned our research team at NUI Galway to carry out this 2-phased landscape and research gap or knowledge gap analysis to map what research is out, what studies have been already done in Ireland and other European countries with sexual and gender minority youth, and to map the gaps in research and data environment that still need to be addressed. Given that, there might be a very large number of studies in this area out there, we have decided that we are using a scoping review technique, and we conducted a comprehensive research process which included searching scientific databases, general online searches, contacting authors of already identified publications and asking them whether they have published any other studies in this area. This is called peer growing. We also contacted various stakeholder groups and international colleagues to make sure that we are finding as much evidence as we can. And we used peer-reviewed literature as well as pieces of gray literature, which have not been subjected to peer review, like research reports. We mapped both the national and the international scene, and also searched for available databases. Our international expert, Professor Elizabeth Sabik from University of British Columbia, Canada, reviewed the findings for accuracy and completeness. I'm conscious of time, so just mentioning there shortly that if you are interested in more methodological details of the study, you can just visit our study protocol and consult the study protocol on the Open Science Foundation website. We have conducted a systematic search with 3 groups of keywords. The first group of the keywords were related to sexual orientation, biological sex or birth-registered sex, and gender identity. So these are capturing sexual and gender minorities. The second group of the keywords were related to the relevant age groups, so youth, adolescent, and children. And we have conducted 5 separate searches with including the 5 outcomes of the Better Outcomes, Brighter Futures, BOBF or BOBF framework. So as the 15 objectives of the National Youth Strategy are aligned with these 5 outcomes, we believe that this way all relevant information will be captured. And as you can see, we have identified 4,603 reports. These then underwent a screening process, which was led by my colleague, Dr. Elena Bohan, and our PhD student, Divya Ravikumar. And we checked all of these records for inclusion criteria. We have included studies which were published in English, individual studies within the geographical confines of Europe, and systematic reviews and meta-analysis without any geographical boundaries. Studies that had been published between 2000 and 2019, and data between 2010 and 2019. And regarding age group, the inclusion criteria was that the majority of the participants are young people aged 26 or younger. We have entered all the identified records into a research synthesis software, and 2 researchers checked all of them against these inclusion criteria. And in case of conflicting decision, a 3rd researcher was consulted. And after this cleaning and screening process, 126 were finally included in the analysis. We have entered those records to an Excel spreadsheet, and we have extracted several information and several attributes of each studies in order to make map the landscape and to identify the research gaps. And the end of this process was that we have carried out an overall evaluation and we formulated recommendations. You can find this table at the 29th page of the report. What we have found, as the minister mentioned before, there is a large varied research landscape, and some objectives of the National Youth Strategy have been very well covered, but others had a rather thin evidence base, if at all. And these studies really widely differed in their scope, in their aims, in their sample, in the methods and variables they used, in what results have they found and what are their implications, and the relevance to Ireland and the quality of evidence. Had we been in a physical event, if only we could, we would ask you to turn to page 33, but you will be able to do that. In this heat map or density map, you can see the research coverage of each 15 objectives. And the dark green fields mark objectives which are well covered with research findings. The light green areas or fields are the ones which have moderate research coverage. The pink ones are having poor research coverage, but still there are some pieces which are talking to them. And the red fields are the one in which the evidence base is very thin. Unfortunately, we won't have time to go through each now, but I will show you an example of each 4 types of objectives. If you turn to the results section, you will see that for each 15 objectives, we have structured the results in the same way. First, we presented the international studies and findings from Irish studies. Then we analyzed additionality and intersectionality of the results pertaining to the given objective. Under additionality, we mean the additional burden of being a sexual or gender minority young person on the top of the normative burden stemming from being a young person, being a child or an adolescent. Intersectionality means that there are many young people who are LGBTI+ and have another identity or multiple identities based on which they can be or are actually discriminated, like ethnicity, religious or racial minority, disability or chronic condition, or migrant status. However, in some studies, we were also able to identify positive aspects and sources of resilience, protective factors. These are also listed. Where we found any good practices or interventions, we also listed them. And finally, we identified knowledge gaps and gave some recommendations for further research. Here you can see an objective, the first one, which has rather good coverage, creating a more supportive and inclusive environment for LGBTI+ young people in formal education settings. This belonged to the second outcome of the BOBF strategy framework, achieving full potential in all areas of learning and development. There were many studies on bullying, and some of them the highest quality studies, including some meta-analysis and systematic reviews, which found a quite robust relationship between bullying and mental health issues in young people. On the other hand, there were also many pieces where young people reported factors which had made their schools inclusive and safe, or which would make their schools inclusive and safe. And many studies were related to gender and gender sexuality alliances. However, also there were many studies which dealt with the topics of social exclusion, perceived discrimination, and feeling of marginalization. There were a good number of studies which listed positive factors such as resilience and factors of well-being and good practices for interventions. And the general conclusion here is that the LGBTI plus young people's voices should be heard and that they should have been engaged in all phases of the research. An objective with relatively good coverage is that, or is the seventh one, providing capacity building measures among service providers to improve their understanding of and ability to engage with LGBTI plus young people. And as you can see, that's a cross-cutting objective, so it speaks to all 5 outcomes of the VOBF framework. I don't know whether it reflects with your own experiences, but many times service providers reported that they were unaware of their clients' gender identity, birth registered sex and sexual orientation. And they often felt unprepared or felt that they lack adequate information and training to address LGBTI plus issues and be effective and helpful in helping their LGBTI plus clients. Some service users reported that they had positive experiences in services, but many times they felt that they weren't understood, that they weren't treated with respect. Indeed, sometimes they were encountered with others homophobic, biphobic, or transphobic remarks. The conclusion here is that attitudes and needs of service providers and that of users should both be met and aligned to each other. An objective with relatively poor coverage is the 10th one, providing an inclusive physical environment for transgender and intersex young people. Again, this is a cross-cutting objective, so it speaks to all 5 outcomes of the VOBF. And what the studies are generally showing is that trans and other gender minority youth are facing even more adversity than those young people whose birth registered sex and gender identity are aligned to each other, who we call cisgender adolescents. However, the good news is that those trans young people who felt that they were supported in their identity felt less distressed, they felt stronger, and they had more sources of resilience. A general conclusion here, however, is that many gender diverse and gender minority people, including trans, gender queer, gender fluid, non-binary, and especially intersex young people are understudied and not understood well enough. And finally, an objective where the evidence base is very thin is the 4th one, ensuring equal employment opportunity and an inclusive work environment for LGBTI plus young people. This belongs to outcome 4, economic security and opportunity. What we had seen is that in most studies, those sexual and gender minority young people who have jobs do not feel that they have any problems in their workplace due to them belonging to any LGBTI plus groups. However, this finding is contradicted by a finding from the States that many LGBTI adults are living in poverty and under precarious conditions. And indeed, in our studies, gender minority young people reported that finding a job was difficult for them, and they often perceive discrimination, more often felt that they are discriminated against than their cisgender peers. However, more studies are needed in the area of employment. In general, we had seen that the research landscape is quite imbalanced. There are much more studies on victimization and the negative aspects as on resilience, identity assets, sources of strength and empowerment. There were only a handful of studies on sexual health of LGBTI plus youth, which is a very pressing area that should be addressed. While there were some studies with parents of LGBTI plus young people, there were almost no studies with the family in general and other family members like siblings or grandparents. Health, well-being and other needs of trans youth were largely understudied, and especially intersex, non-binary, genderqueer and other gender diverse youth are almost entirely missing from the landscape. Specific problems to research are that most of the studies use the community sampling strategy, with participation bound to parental consent. I know this raises many ethical conflicts and issues, but we have to discuss and we have to address the problem that if we stick to parental consent in LGBTI plus youth research, we are unavoidably necessarily excluding those young people who are not yet out to their parents. There were many studies solely with sexual and gender minority young people. Comparisons between sexual and gender minority and non-minority youth were very rare. And even in the existing studies, the proportion of sexual and gender minority young youth people was quite low. So we have to find out innovative data collection and analytic techniques to overcome this barrier. For instance, we could use oversampling or case control matching. Many studies reported descriptive stats, but it was quite rare that they moved beyond. So in fairness, we aren't in a position to draw robust conclusions or make, for instance, causal inferences on what are the causes and what are the effects. So more studies, for instance, in longitudinal settings are needed. Additionality, intersectionality, and multiple marginalization remain studies that should be addressed, or areas that should be addressed. Although I have to mention that we had seen many studies in which data are actually there on intersecting identities or multiple minority identities, but these seem to be not that much analyzed or not that much published area. And what is also a quite urgent need in the European landscape is that we should carry out more intervention studies and to assess the efficacy of interventions to improve LGBTI plus young people's lives. Our study is limited by the fact that we have only collected studies in English language, while a series of rapid reviews show that there are many other pieces of information and research and evidence out there in other languages. Therefore, the study is not giving us an opportunity to make global conclusions, although we know that there are many valuable research out there in, for instance, Australia and New Zealand. Some might argue that we should have included studies from the 1990s where research in this area really started. And we totally agree with this, but that's what the infrastructural and financial constraints of this study made possible. And despite our best efforts, we are acknowledging that there might be some outputs which we might have not identified. Still, we think that the study is giving a comprehensive overview of the late research landscape and the knowledge gaps, and it's used a more multidimensional analysis, so it might be able to address the strategic priorities. What's next? We have many plans to disseminate the findings. We have prepared some short reports for stakeholder groups. Dr. Vaughan and our colleague Aisling Harrington led this work, and soon we will move into breakout rooms. So we will collect your ideas and inputs, which we would like to integrate into those stakeholder reports. We also plan to do further presentations and write journal articles for the scientific community, and to formulate some methodological recommendations for further studies. Such an immediate first step could have been that youth population studies include an inclusive measure of sex, gender identity, and sexual orientation, and certainly many research questions are stemming from this work. So there are implications for many stakeholder groups, not only for young people, but for their families, for general and LGBTI plus specific youth services, for decision makers, research commissioners, funders, and for researchers. And we would be very glad to hear your ideas and if you shared your insights about those with us. And there have been a lot of people whose help and efforts were instrumental to this report. I would like to thank them all. You will have my email address since I have sent the registration receipts and the link. Please feel free to contact me anytime. And thank you very much for your attention.
So I'm just checking if Alina is going to lead out on some questions now, if that suits.
Yeah, thanks, Bernie, and thanks to my colleague Andras for that great presentation. Can I just ask anyone if they have any questions they want to put to Andras or myself or the rest of the team? They pop them into the chat function. We've got one here from Cecilia, which I might put to you, Andras, if that's okay. In terms of the research coverage for objective 1, how much of this is in the context of primary education, 4 to 12 years? And that's from
4 to
Cecilia
12.
in the INTO.
From 4 to 12 years, the studies are extremely scarce, mostly because it has been seen that the first age when young people are available to identify themselves as LGBTI is around 9 to 10 years. And some researchers say that since sexual orientation and gender identity are actually stabilizing or solidifying only in adolescent age group, in primary schools, the studies are very rare. However, I know that there are some interventions and some programs which are raising awareness in younger generations, and they discuss different elements of sexuality with young people, and they seem to work very well.
Okay, thanks, Andras. Anyone have any more questions? I have a few here that were emailed to me. So some person was asking, can we get access to the studies you included in your review? So I might take that. Certainly there's a comprehensive bibliography included in the report, and all the studies should be accessible there. There's DOI numbers and all the information should be there. So hopefully that will help. We have another question here. I'm wondering, hello, and thanks for all of this. I'm wondering whether studies address sexual behavior, sexual activities, or sexual self-concept, and that's from Professor Plant. So Andras, do you want to take that one?
Many thanks, Professor Rebecca Plant, for this question. Most studies in sexual health were around STIs, prevention and protection used by young people, and somewhat surprisingly around pregnancy involvement. Self-concept and sexual satisfaction and other areas of sexuality were very rarely analyzed.
Okay, thanks, Andras. I have a question from Ayrton Kelly. It's directed at the DCE DIY. So we're just taking questions that are addressed at the researchers for the moment. So if you want to address any questions to ourselves, to the research team, please go ahead.
What I might do, Alina, is just for the purposes of time, is maybe we might hold more questions and then we might deal with them in the breakout session, if that's okay. Would that be okay? And I would say, please, people, do feel free to put your questions on the chat bar. And if we can't reply to them today or through, the feedback on the breakout rooms, etc., we will absolutely, the team can come back to you. So maybe if you don't mind, we will keep going. So thank you, Lena, for leading out on that session. And thank you, Andras, for bringing us through the study. I mentioned earlier just the breadth of it, the spectrum of information that you uncovered, and really I think policymakers now have a massive breadth of information courtesy of this study that will really help influence and shape policy and help prioritise research funding, etc. There's certainly some very striking gaps that you've identified, and I think there's a pressure on us now to try and fill some of those gaps. So thank you, and sincere well done to the team. So we'll keep it moving, and the next couple of speakers are again very, very central to this event today. So I'm delighted to welcome the first young person. So Clodagh Scott is from from Dublin, a third-year student in UCD, studying social science in UCD, but managed to escape COVID Ireland to the University of Zurich for Erasmus. Lucky her. I wish she was actually presenting on her experience there, but we better keep to script. So Clodagh is a member of the LGBTI Plus Youth Forum that was formed as part of the LGBTI National Youth Strategy back in 2018 to 21. And people might be familiar that that forum has developed the LGBTI Plus Youth Leadership Programme, which I think has been really, really critical, a great output to see. And they're about to host a celebration event of that programme, so more of that anon. So Clodagh, in her spare time, is a co-founder of the International Action Group, which is a group of young people from across the globe seeking to discuss local, national and global issues, including LGBTI plus roots, through their Instagram account. So over to Clodagh. Thank you, Clodagh.
Hello, and thank you for that wonderful introduction, Assistant Secretary General McNally. I'm Clodagh Scott, and I'm delighted to be here today. As a member of the LGBTI Plus National Youth Strategy 2018-2020, it's really interesting to see a report like this. I'd like to thank you for the opportunity to speak today, and I'd like to acknowledge the significance of this study as more people can now study it, and that our actions can now be more targeted going forward. It made me sad to read the report, seeing all the difficulties and challenges youth like myself experience. Having experienced mental health problems and bullying, I can relate to you, my fellow LGBTI plus youth. My hope is that this study will be heard and, most importantly, acted on. Our mental health is bad. We do not receive enough supports. The adults around us, there to help us, do not always understand and at times make it worse. This work highlighted the positive effects of a supportive environment in schools. I can tell you schools are changing and have changed since I finished school. I was refreshed to walk into my school and see LGBTI posters and excited to see the initiatives of the Dublin City Corla and taking actions for school to become safe and happy places. Let's listen to these quite shocking facts from the report and make changes now. We are a part of society and need to be heard and accepted, supported and normalized. Without education and awareness in society of the experiences and lives of LGBTI youth, our lives will not change. So studies like this are really significant and a great way forward for the improvement of the lives of LGBTI plus youth and acknowledgement of where it's going really well. This study showed that schools want more knowledge and support around providing for students. And I can tell you that this is absolutely key from all the discussions I've had with others in the community. It also showed that youth work want help in providing a safe and wonderful place for us to be. Let's go about and make those changes. Let's change the lives for LGBTI youth like me.
Clodagh, thank you so much for your honesty there and your forthrightness. You clearly put a lot of time into preparing that couple of minutes, and I really love the strength of your call to action. So I hope that, and I certainly know our minister is committed to doing as much as he possibly can. So thank you, Clodagh, for that. Okay, I'm going to move on to the second young person. So Cameron Kieran, also another person today with an enviable CV, is a PhD student in electrophysiology studying Parkinson's disease in NUI Galway. Cameron's been involved in advocacy, activism and volunteering over the past decade, starting with writing letters for Amnesty International as a teen in school. Cameron is the chair of AMOC LGBT Plus in Galway, president of Enlight Student Board, a student partner in the Inclusive Learning and Development Project, and a youth panel member on the D1 Now study looking to improve healthcare for young people with type 1 diabetes. Cameron is passionate about changing the way we view the world around us and ensuring that all folks feel empowered to have their voice heard. So over to you, Cameron.
Thanks so much, Assistant Secretary General McNally there for that introduction. And thanks folks for giving me the opportunity to speak today, and also for attending and listening to the results of this report, and also listening to myself and Clodagh, which we're very grateful for, and we're very grateful for the opportunity. I'm going to talk about three things today, or three things I'd like you to think about from the report today. But before that, I want to give you a little bit of context about who I am, beyond, I suppose, the biographies that we write and the things that we put in about what we're doing, but really about who I am as a person and why I'm passionate about this type of work, and why I'm passionate about the LGBTI plus community. Because a lot of the stats that you will have heard and you will read and you will see in the report relate to people like me and relate to people like Clodagh and relate to a lot of people on this call. I was born in Sligo and raised in Sligo. I'm now in Galway for the better part of 8 years. My parents have never forgiven me for supporting Galway GAA, but we're there now. But I was born a little baby girl. I don't look like a baby girl now. And at the age of 3, knew that things were different. But I didn't have the language to explain to people what that difference was, but knew it very, very centrally to me. Growing up in school was tough. A lot of people don't talk about their experiences in school. A lot of my friends that I had in school don't talk about their experiences, because I want you to imagine being a teen surrounded by a world that you didn't fit into, that you didn't belong in, and that's reflected in this report, and never felt like you would, trying to do anything to avoid that isolation, to avoid being that lonely person, to avoid the hurt that you were feeling, and desperately wanting to be that normal that you saw everyone else being. And I want to take you through one experience that I had, and it's related to one of the things that I'll talk about. And it was this Pride whistle that I bought. And I was maybe 16 at the time, and I happened upon Dublin Pride at the time. My first time ever seeing a Pride event, my first time ever seeing people celebrating being LGBT plus. And I bought this Pride whistle, and seeing those people and seeing that visibility and seeing the support of the community, when I got home, I stopped wishing to be normal, and I started wanting to be me. And I slept for every night until I went to college, so 2 years, with that Pride whistle under my pillow, because that was my little bit of hope. That was my little bit of connection to the community. And that's something that's really important and something that I'll highlight further on. So what are the 3 things that I want to tell you about or talk to you about? And the first one is about us celebrating people getting through a tough system, as if wearing a badge of honor of suffering for minority communities is the only way that we can attain respect from the majority around us. That by celebrating the 1 or 2% that get through employment, that get through education, that get through primary, secondary school and into the workforce, or lead happy and successful lives, that we pat ourselves on the back and say, well, great, we've got diversity because 2% have made it through. And we create those systems where that's all that LGBT plus folks see. And diversity seems to mean celebration of the 1%, as I said, making it through that suffering, rather than making real systematic change that this report is calling for and that this research is highlighting. How do we tackle bullying? We know that bullying is happening, but what are we going to do to change it? How are we going to create a more equitable system in our schools? How do we actively support LGBT plus folks who want to go into the workforce, who want to go into further education, who want to study at postgraduate level? And to give you an example, in my university, I know of 2 other openly trans folks who have completed their PhDs. As of right now, I don't know any other openly trans person completing a PhD in my university. And that's a very lonely experience, despite being quite vocal and quite out. That's still something that sticks with you. So how do we support inclusive research on trans youth that's highlighted in this report? And how do we do that in a way that supports the inclusion of their voices in everything that we do? The second thing I want to talk to you about is that research needs to explore the positives. Young people, and I was and still am, are surrounded by all the negatives around bullying, mental health, safety, etc. That we don't talk about how supportive environments can change everything, and how supportive environments and the positivity of, or the positives of visibility really influence a young person's life. How talking about things like gender euphoria change the narrative and change the conversation to something that should be celebrated and something that should be supported, and that there is, I suppose, that hope out there that even though maybe school could be tough, that there is people willing to change that narrative and willing to change that environment. And the last thing I want to talk to you before I hand back over to the team is that the stats you've heard today are real young people. They're real lives. And often we get stuck behind the numbers and we fail to see the lives behind them. We look at 60% are suffering bullying, or 10% are this, or 20% are this, and we forget to see the faces. And I want you to look around and see the faces of young people on this call. And when you think about those statistics, think about those young people. Because no matter how much we want to make change, if we rely just on the numbers to make that change, we're never going to have a real impact, because we've never really thought about the real people behind them. So as policymakers, as researchers, as key stakeholders, I ask you to take one thing from this report, and it's to remember the words that Claudia and I have said. Remember the faces of the young people that you see on this. Remember the faces of the young people that you interact with, and always remember to include those voices in the research that you do. So thank you so much for your time, and thank you so much for listening.
Cameron, thank you so much for that. And as I said with Clodagh, I knew Clodag's content would be so central to this event today, and your contribution, Cameron, thank you so much for your honesty, for sharing your call for that systematic change, you know, not celebrating the 2%, but looking for 100% for systematic change. Like, I know we celebrate that we've achieved some things in this country in recent years, but we have a lot more to do. And I think researchers, policymakers, I think we're listening, and thank you for putting it so articulately to us today. Thank you. Okay, we're going to keep moving and we're going to now break up into our breakout rooms. So we really, as I said, often the breakout rooms end up being one of the more valuable elements of sessions like this. So we really would love to have your viewpoint. We've broken you up into different groups. We would have loved to kept everybody very mixed, but we thought it would probably be best if we got feedback from 5 groups: young people, educators, service providers, policymakers and researchers. So you're going to be sent off into breakout rooms. We've had to cut the time a little bit, so it'll be about 15 minutes. There's going to be somebody in your room that will take notes and that will feedback. So we'll be coming back together in 15 minutes time, and your rapporteur will just give us a very quick highlight of the feedback, that what you've discussed during the meeting, but more detailed notes will go to the researchers and everybody involved. So we'll get more than just the quick highlights that will be brought back to the full group in about 15 minutes. So thank you. See you shortly. Thank you. Okay, I think we're being rejoined by people from the breakout rooms, so I'll just give it another few seconds in case there's a few more joining us. And I might also put the people who are going to feedback on notice that I'm only going to ask them to really give a very quick highlight, so just half a minute, because I'm conscious of time and we have run over a little bit. So rather than all the people giving feedback having 2 minutes, I'm going to cut it to about 30 seconds. I hope you don't mind me doing so, just for the sake of everybody's time. I know they have other things to be doing this evening. So I think, Linda, are you happy? I don't see Eileen there. Are you happy for me to go ahead? Do we have as many back possibly as we need?
I think, yeah, Eileen is back and Eileen's group is back. Yeah, I think we're good to go.
Okay.
Bernie, yeah.
Okay, so look, whilst everybody just gets back into the room, I might just take this opportunity to say a few closing remarks. Again, what we'll do is to only keep you for another 5 minutes. We'll ask each of the people giving feedback to just give me 30 seconds, so a really quick highlight. And it's not that we haven't done justice to the groups. We will note everything, all the discussions during groups, and we'll make that available. But can I just thank everybody who's participated today, clearly to the research team in Galway for producing this piece of research. We're really, really grateful. Thank you to the young people, to Clodagh and Cameron. I have to say, you gave really strong. You had a limited amount of time today, but you used every second of that to really, really good use. And I know certainly I've taken a few messages from it. So thank you for that. Thank you for the facilitators, etc. in the groups. I know you were under a little bit of pressure, and everybody that was involved in organising this, but particularly thank you to everybody who's taken out this time in their afternoon to attend here. We really appreciate it. This research, I suppose, it's never an end, it's always a beginning, and we've got a very, very strong message today about the amount of work now that we have to do to act on this study and other information that we know, so that we can reach that objective that was set out in the LGBTI Plus National Youth Strategy about all young people, all LGBTI young people being visible, being valued and being included. So thank you to everyone involved. So I'm going to turn to the 5 spokespersons for the groups for just a very brief, in a nutshell, message back from your group. So I'll start with Eileen and then I'll go to Barbara. So Eileen first, please.
Can I just switch to Soph? I sent David a message. So Soph Mullet, I'm just looking here to see if I can.
Hi.
the youth representatives and from the young person group, we came up with a long list of questions to the questions on what can make a space more inclusive, as well as what are some important health needs. Some of them were queer sex ed, as well as trans healthcare and training for GPs and teachers and guidance counselors, etc. These will be able to access at a later date. Thank you.
Thank you, Soph. And I'm sorry for putting you under such severe pressure, but you did really well. So thank you for that. And thanks, Eileen. Okay, Barbara. And then I'll go to Linda after Barbara.
Training was also a big item on our group of service providers, training for mental health providers, for managers, whole of staff training and guidance on practical ways of how you can show your space is more inclusive and show that you're LGBTI friendly. We also had, there was also a marked call for standardized approaches and development of national services, starting probably with a robust healthcare system for children and adolescents, gender services. And of course, the one thing that came across strongly was the need to consider the rural dimension in all this, that a child living in rural Ireland might have a very young person might have a very different experience than one living in an urban centre where services could be accessed more easily. And someone noted the knock-on effect this would have on gathering accurate data about the number of LGBTI young people who are out there looking for services. Was also thought to be important to get the word out about the supports and services that do exist and that are available, and to acknowledge them and to encourage people to use them. And this takes investment and resources.
Great, Barbara, thank you. And thank you for being succinct also. Okay, we'll go to Linda, then Grania, then Anna.
Thank you. We were in the educators room. So again, training and capacity building was a very big theme in terms of teachers' skills. The fact that they need to be fluid, updated, and undergrad and postgrad courses need to include training or updated information, as well as the Department of Education providing clear requirements and with LGBTI inclusive resources and textbooks. In terms of how educators can contribute to increasing the visibility of LGBTI identities, the question of expecting LGBTI young people to be in settings rather than accepting it, and therefore to have an inclusive culture, using pronouns in opening circles, and celebrating LGBTI plus young people with positive role. Be confident.
Thank you very much, Linda. Okay, Grania and then Anna.
Hello, I was in the researchers room, and the first very strong message that came through was nothing about us without us. This comes from setting the research questions. They should be done in conjunction with LGBTI youth and families, to setting the research methods, to having people involved all the time overseeing the research, to feeding back the results and how the policy changed because of the research. So the whole life cycle of the research. When stakeholder engagement was set up, it needed to involve everybody, not just teachers and the pupil or young person, but the example was given of the I forget the word now, the person looking after the building and stuff, so that everybody who might have a stake in the person's well-being was included. Ring-fenced funding, the need that the government absolutely earmarks money for research in this area. But finally, as researchers, we should never forget intersectionality, and somebody's sexuality or gender is just one aspect of their being, and we should always bring in the other elements of their being and consider those, and consider how they change the results and the findings.
Thank you, Grania. Very much appreciate that. Okay, and to Anna. Last but not least.
The advantage of being last is that actually our discussion reflected a lot of that as well. So I don't need to say any of that. But I think one thing that captured it is we had a very rich and energetic conversation, and it was very much around all of these interventions being a learning journey. We're constantly learning and bringing things together to think about how we can provide better services, and that's for policymakers as well as service providers. And we talked about 4 kind of core elements of that learning journey. So building in evaluation and making sure that we're really learning from the interventions as we go through, building our data infrastructure, the data that's already there and how we're using that, learning from action. Sometimes we don't have the full evidence base, but when we go in and take action in response to particular needs and challenges, we can learn from that as we go through. And then of course, as Cameron very eloquently reminded us, learning from young people and young people's experience the whole way through the process.
Thank you very much, Anna. Okay, so everybody, I did kind of give my closing words earlier, so I'll just finish by thanking you all again for attending this late in the afternoon as well. Please read the study, dip into it every now and then to remind yourself about it. Please engage with the findings. A key word from today is act. So let's all think about how we can act, be it as researchers, as young people, as policymakers, but what are the actions that maybe this study can inspire within us? Please engage with LGBTI plus young people when we're developing policy and doing further research, etc. Please enjoy the rest of your evening, and thank you so much and stay safe. Take care.